I'm Dr. Jess, and I'm one of the chiropractors at Chiro for Moms. And I'm here with Jennifer, and she is a midwife at New Birth Midwifery. And so, Jennifer, why don't you explain who you are and how you got into midwifery and specifically with new birth?
Yeah, love to. Thanks for having me, Jess. This is a lot of fun. Yeah, I have been a midwife for a hot minute. I actually graduated from midwifery school in 2008, and then I opened my own home birth practice called New Birth Midwifery in 2010. So I ran the practice just as a really small, like did about maybe 20 to 24 births a year. And just kind of kept it small while I was the only one running it and trying to grow our family. So went from having no kids when I started to now have 4 kids, and my youngest are 6. So it's been a big change in our personal life, but I didn't really want to get so busy that I couldn't also be home for events and, getting kids off the bus or doing things like that. So I liked working by myself, but I also really, really missed the camaraderie. I feel like midwifery is a difficult enough job, and then to do it by yourself, I just really was looking for someone to do it with me. And then I met Sarah Barbosa through a mutual friend of ours, and she and I just clicked. We went to a birth together one time when I ended up needing a quick assist, and she happened to have a day off, and it was a good birth, but there were just a couple of things that we needed to do to kind of help with a bleeding situation. Anyway, I would turn the corner and be like, I need, and then she was giving me what I needed. And so it just felt like from the moment I was like, oh my gosh, this girl like knows me, and we've never worked together, and yet it felt comfortable. So we pretty quickly started talking about partnering together. She was looking for a partner. We both were not expecting the growth that we've had. I still wanted to kind of do midwifery part-time, as if there is such a thing. And I wanted to, I know she wanted to as well. And so we were like, here, let's take, maybe 40 births a year, like, do like 4 to 5 births a month or something. And then when COVID hit, we just got real busy because moms were like, hey, let's not go where all the sick people are, right?
Yeah,
So instead of me learning how to make sourdough during COVID, I have learned how to make it now.
that's fair.
Yeah. So
Oh,
that's
that's
kind of
amazing.
the short and long story of my midwifery journey so far.
And how many are on your team now?
Yeah. So our team has grown. We actually got to the place where we had 4 primary midwives who are the first on call, kind of in charge at the births. In when we were in our office over in Waconia. So we were still only doing home birth at that time. But we had to keep like closing down our radius further and further. And that was really hard for us to be telling moms no. And they're like, gosh, you guys, we only live like 40 minutes away from the birth center. And I was like, oh, shoot. But my midwives are usually coming from home at 2 in the morning
Yep.
when you call. And so you're like actually an hour and a half away from us. And so we just felt that need to grow into a space where we had a birth center offering as well. So now that we have that, we have technically still 4 primary midwives, but Sarah and I share one of those roles because also running a birth center is a lot of work.
Yes.
Sarah and I can't also be full-time midwives. So technically 4 primary midwives, and then me and Sarah being kind of one.
Yeah, absolutely. So essentially
Yeah.
5 with you and some
Yes. Yes.
combined. Oh, that's
Yes.
amazing.
We are different people.
Yeah.
Yeah.
How many rooms do you guys have at your birth
Yeah.
center? Is there the
Yeah.
4 then for each midwife then, or?
No, we only have two.
Okay.
We found this space in Chaska. So we were in Waconium and we found this space in Chaska. So it's just real close, kind of to the intersection of 212 and Engler. So it's, easy access for a lot of different people. It used to be actually an old dentist office. And so it was pretty helpful for us when we did kind of the renovation part of it. Because they already had a lot of they like already had a lab room in it. We're like, oh, we'll keep that, please. Thanks.
Yeah.
But a lot of the research shows like you can do up to 30 births a month in the birth center and only have two rooms because we only keep our moms at our birth center usually for like 4 to 6 hours after delivery. So that really changes things, right? From a hospital method of, you stay for a day or two after delivery.
Okay, that
Yeah.
makes sense. Do you guys still do home visits or
Mhm.
not so
Yeah.
much?
Yeah.
Okay.
No, we do. Through the end of this year, I would say we're still doing about half and half. We're still doing about 10, maybe 12 births a month at the birth center. And then we're doing about 10 births a month, actually still planned home births.
Okay.
Because we had a really solid foundation of clientele that they're like, that's super cool. You guys are building a birth center. Also, we still really want you to come to our house.
Okay.
So we have a pretty loyal following with that. And all of my midwives seriously love home birth. And so I don't know that we could ever truly be done doing that. It's just like a different level of, yeah, I don't know.
Yeah,
It's kind of magical to welcome your baby into your own home in your own room.
right.
We've tried to make the birth center as home-like as possible. If people want to see a tour of the birth center, but not come over to, walk through the space, which people are welcome to do. But if you want to see it, we actually have like a video tour on our website too.
Okay, that's awesome.
So people usually comment, they're like, oh my gosh, this doesn't look like a hospital room.
Yeah,
And of course, that's always the intention. Yeah.
that's awesome. And so personal question here from my
Yeah.
husband. But we've been chatting about wanting to start a family eventually type of thing, not
Yeah.
who knows when that ever is going to happen. But I was trying
Perfect.
to push him and be like, okay, when this happens, let's do home birth. And he's like,
Yeah.
no, we need to do birth because they have more stuff there. And I'm like, can you
So
explain to me whether or not there is a big difference between doing a home birth versus a birth center? Do you have the
I'd
same
love to.
stuff? I don't even know.
You have the same stuff. Biggest difference that it's kind of a cheeky response, but the biggest difference between home birth and birth center is who does the driving, you or me, and then who does the setting up, you or me, right? So when our families choose to do home birth, then we give them a shopping list. You guys got to go on Amazon, gotta go Target, Walmart, garage sales, gotta get us some towels and floor covering and, a hose and things like that. But we provide the pool. So we'll just loan you out a really big blow up pool. And then all of our midwives carry, I mean, I drive a minivan for this purpose of having 4 kids, and I have all my midwifery stuff like
Yeah.
in the trunk of my car all the time. And so we carry, everything that we need to help a mom, if it's herbal, if it's medical, if it's, a rebozo, right? Like we just carry all the tools that we need in the trunks of our car. But then also, I would say like the only difference, right, in a birth center is that it's like my stuff is already set up for me, like in the drawer in the room. Like I don't have to carry it in the house.
That's
But yeah, and then the pool is already set up. So you're looking at, I mean, we actually use the same pools the birth center pools that we got are actually, they're acrylic, but they are created by the same company that made the birth pool in the box pools that are blow up that we give to our family. So it's kind of just a funny little thing that I didn't even know, but
That's
they're
so
really nice pools either way.
yeah.
So yeah. So that's kind of a misnomer, right? I would say one thing that helps some dads feel a little bit more prepared, perhaps at a birth center setting, is that we will do drills with like our local EMS providers, and our EMS providers know where the birth center is. They know what door to come into. They're not just pulling up to someone's house, right? And then they're able to just kind of figure out, they know exactly how to bring people in and out because we work with them and they know us. For our home birth families, we talk with you guys prenatally. We talk about how most of our families who choose to birth outside of the hospital setting, once they're in labor, only 11% of them are ever needing to change locations to a hospital. And then from there, only 2% or less are ever going to need to go to the hospital in a more emergent fashion, like using EMS. And so it is a very low rate, but midwives love to be prepared and our families love to be prepared. So we talk a lot about that ahead of time. We say, hey, Jess, what's the hospital that's closest to you? And we're like, cool, like, there's no midwives there. Let's maybe not use that hospital unless it's an emergency. We'll totally go there. But then we have a big list of hospitals actually in the metro that do what's called midwife to midwife transfer. And those are our favorite hospitals to go to because I can actually call them ahead of time and be like, hey, my client is doing great. Her vitals are great. Her baby is great. Everything's great. She's just been up for 2 whole nights working hard. She's been throwing up. She can't keep anything down. We just need some pain relief. That's not available in our setting. So we've tried the water immersion. We've tried the movement. We've tried feeding her. We've even tried IVs, but she needs an epidural, right? And if that's all my client needs is an epidural and a little bit of Pitocin, a midwife in the hospital is the perfect choice for her. She doesn't need OB care at that point. So then we'll still go with our families. We'll still get them settled at the hospital. We still, care for them. And then we have them discharged back into our care to do postpartum
Okay.
if we transfer.
Oh,
But most of the time we just come and hang out and we ask you guys, like, how do you want your birth to go, right? Like, does your husband want to catch or does he faint at the sight of blood? And
right.
does he stay by your head? Like, so we
Absolutely.
can do a lot of customization for our families.
Oh, that's amazing.
Yeah.
Is there a certain criteria on whether or not a woman could deliver in a birth center versus a
Yeah.
hospital? Okay.
Yep. So we only take, when we talk about hospital birth, or then we talk about birthing outside the hospital, a new term in the last, I would say like 3 years has been using the word community birth instead of out of hospital birth, because we don't want it to be a birth that's like, hey, hospital is the golden standard and everything else is not. Because actually birth started outside of the hospital and has been outside the hospital much longer than it ever was in the hospital. So we want to honor that history that comes with that. And so when we say community birth, we mean both planned home births and planned birth center births.
Okay.
In Minnesota, all birth centers are required to be CABC accredited. So it's the Center for Accreditation of Commissioned Birth Centers. So it's this big organization that really is like for midwives and for families, and their ultimate goal is to make birth as safe as possible. So that just means that we have kind of like a double set of rules for the birth center. For our home births, we have rules that are set out by our licensure in Minnesota. but it's actually written a little bit more, I don't know, like loose maybe for like interpretation. There's like guidelines and there says like, hey, this is safe birth. But they were written by midwives who wanted to have a lot of autonomy. And so at home, I mean, if a midwife chooses to, she can actually do planned breech births. She can do planned twins as long as the criteria is good. There's quite a lot of room for that particular midwife to decide what her interests are and her family's interests are in continuing their home birth. For the birth center, we just have a slightly tighter scope, because what we're trying to also do is say not just the birth centers in Minnesota, we're saying all the birth centers in all of the US, this is our golden standard. So for our birth center births, we can't do twins. So if we find twins during a prenatal, then we will help you guys find another care provider. We can't do a planned breech, but midwives are really, really good at getting those babies to flip head down. We work a lot on crazy exercises. We send them to the chiropractors and we do all kinds of things working within our community. And our families are pretty good at getting, I mean, and there's like 4% of all babies are not head down at the time of delivery. So most of the time that's not an issue anyway. One thing that does match between home birth and birth center is we cannot deliver at home or birth center before 37 weeks and 0 days. There is like a tiny bit of wiggle room on the home birth side of like, if you were like 36 and 5 or, something like that real close, then the midwife and the client could choose to do the birth still. At the birth center, at our birth center specifically, we're saying 37 and 0. And then on the other side, that's actually a bigger deal, right? Because I mean, midwives work a lot with their families with nutrition and movement, and our families are already like very much wanting to work on their health and wellness. So we don't have a lot of preterm deliveries anyway. But on the other side, did you know, probably you do because you've interviewed midwives before, but that a lot of babies, I mean, what we call our due date is just a guess date, right? And it's just kind of what we pinpoint, but that's really like depending on a woman's cycle, like how regular it is, and just there's a lot of factors that go into that. And so what we like to say with that guest date is for all of our first time moms, you should tell everybody you're due 10 days later than you really are, because it's pretty likely that your baby will not be excited to be
Gonna
born
go
before
over.
that.
Yeah.
And then it just helps you to not want to throw your phone against the wall when one more person texts you at 40 weeks and 4 days, like, oh my gosh, you're still pregnant.
Yeah.
Um, so we, at the birth center, we have a hard stop of 42 and 0 at midnight. At home, we can take it a little bit longer. It very much depends on that mom and that baby. And we, in both settings, are doing quite a bit more monitoring at the end. At new birth, we've developed what we call a labor party kit. So
That
we
sounds like
actually
fun.
say, I know it's not really fun though, but we do call it a party just to try and make it not be so horrible. We do some of the normal stuff like castor oil at the very end if we have to, or breaking someone's water if we really have to. But there's a ton of things that we can do way before that, that are very gentle. And if we're very patient and we're waiting until that mom is 41 weeks, then her body is generally very receptive.
Okay.
So sorry, that was a super
No,
long-winded answer to
I
your
love it. The
question.
more information, the better, to be honest.
Good.
Um,
Okay, good.
And you did answer my other question that I had about the breech babies.
Breeches,
And
I kind of,
so
yes,
which
I
is
had that in
great.
my head. I was like, "Oh, I'll just tie it in."
Yeah. No, I love it. And so at home, if it's known breech, then it's whether or not that mom wants to go through that, midwife's
Right.
okay with that, but at the
Yeah,
birth center, you can't.
right, right.
Okay.
I mean, that baby's butt would have to be, like, visible
Yeah.
for us to be like, we're still calling EMS, but probably they're not gonna make it before the
Right.
like, we're trained and we know how to help with breech, but we have to show at the birth center that we have done everything possible to get that mom and that baby, to, appropriate care facility. Yeah.
Okay. And another question that I had as well that just came up, is there any sort of like medical, like major medical conditions like placenta previa or anything
Mm,
like that that inhibits the ability to have a vaginal delivery at a birth
yeah.
center or?
That's a really great question. So we do VBACs, both locations. So a VBAC is a vaginal birth after cesarean. But for our practice, we will limit it to just one C-section. There's midwives in Minnesota that will do it after two. And we're huge supporters of that. In our home birth practice, perhaps we could do it after two. There's not regulations, but at the birth center, it'd have to be after one. Um, Placentas, they just can't be fully covering the cervix, right? So I can't have like a 20-week anatomy scan. Here's your cervix and
Mhm.
here's your placenta. It can't be like this because the baby can't come out that way, right?
Right.
Um, but a lot of times, even if we find that at 20 weeks, we're doing another scan at like 34.
Okay.
And then that placenta usually moves because that uterus grows and pulls that placenta with it.
Mhm.
So that placenta can't be closer than 2 centimeters to that cervix, because that does increase the risk that it could, on that lower part, it could increase the risk that it would come off of the uterine wall before birth, and that would be a true emergency. So we talk with our families. I mean, nobody is planning a home birth or a birth center birth, any kind of community birth, being like, this sounds really risky. Let's try it anyway, right? So I
Absolutely.
love that about our families because we're not ever saying like home birth or bust, birth center birth or bust. We're actually just saying, hey, let's partner together and let's treat birth as normal until it's proven otherwise, or keep birth normal because it is.
Absolutely. I love it.
Yeah.
And
Yeah.
do you guys do insurance? I heard a rumor from the
Yeah.
grapevine that you're just starting to get insurance and everything like that.
Yeah, that's the hot button question of the day. So we did just receive our CABC accreditation officially in the mail last week, which was amazing. It was a huge relief. Thank you. We're very excited about it. So that was an absolute requirement for us to push things through with several different insurance companies. So now that we have that, we kind of had like all the dominoes ready to fall. But then as soon as we got that piece in the mail, now everything has been sent out for what we call the facility. So some of us providers are already in network as providers for the insurance companies, but that's not the part that insurance pays very well for. They pay a little bit, but not great. The facility is where the families are actually going to see good coverage for their births, because that's where we can kind of explain like, hey, we do a lot and let me show you what we do. And so then we can negotiate our rates a little bit better. So for us, I mean, there's several birth centers in the Twin Cities areas that are in network, right? There's different places that have been open for a lot of years already. And so when we have a family who finances are a big struggle, we're so transparent with our families and we never want anyone to be in a difficult spot. So we'll refer to other birth centers and we'll say, hey, look, we're just not in network yet. Why don't you go to one of our sister birth centers and then get your birth covered better? Otherwise, we will also say, partner with us now. You're only, 12 weeks pregnant, and we just need to be in network by the time you deliver because that's when we send all the bills in. And so chances are really good for any family that is in their first part of pregnancy, like 20 weeks or less. Chances are really good that we'll be in network for them. But in Minnesota, we have to actually become Medicaid providers first before these other companies will even look at our stuff. Medica is the only one that will even talk to us before we become Medicaid providers.
Okay.
So it's long and short answer is we're working hard on it. We expect it to come in by the end of the year. And yeah, we're telling all of our families, feel free to just keep calling our front desk. And, you know, I would say we have several families who call
Yeah,
every month, and then they're like, okay, are you in network yet? Okay, are you in network yet? And I think that people will switch over to us. I think some people are, being cared for at the hospital and are waiting for that. And that's fine with us.
yeah,
We'll happily welcome our families in when it's affordable to them too.
absolutely. Insurance is so tricky. Like,
It is tricky. I
it
bet
is
you
very
know that from
tricky.
your side of things too.
Well, we're just cash at our clinic, which
Oh,
helps
that
out quite a
sounds
lot.
so nice.
And so we're able to do like we don't have to follow insurance guidelines, which is
Mm,
really fun. And so we're able to do
love
like
that.
way more muscle work, way more
Love it.
care on people. Like if they want their shoulder and their knee done, we can totally do
Oh
that.
my gosh, you
So
can
it's like
do both.
we
You
can
can
do two
actually do
things.
what your client needs.
But no,
Amazing.
honestly, I was interning at a practice that did insurance and it is
Mhm.
very tricky. And so I'm truly very happy to be cash practice
Mhm.
right now. But
Yeah. I
um
mean, that was my world, right? For the longest time was I've always been out of network. So the in-network piece is very new to me. I think we need to do that for the birth center because there are a lot of families like you described with your husband. Like
yeah,
this birth center is like a stepping stone.
yeah,
And it does create more visibility. It helps more families feel more comfortable. You are pretty like normal family where the mom is like, okay, fine, baby number one at the birth center, but just you wait, like we're
yep,
gonna end up at home eventually.
exactly.
And
I,
it's fine, it's good, but we need to create that middle ground. And so we have like payment plans and all sorts of stuff like that for our families. We can do HSA. We love creating plans that make this affordable for people.
so the in-network is only at the birth center. Home births are still out of pocket.
Yeah. That is a good question. Yep, we still need to work out what our payments would be for our home births because what would happen for a family who's planning a home birth with us once we're in network, say, okay, we've got our contract for Medica but they really want their birth at home, then what we would do is bill in network rates for their prenatal care and their postpartum care because that's done in the birth center, but then their birth having been done at home will be billed out of network. And then we will need to bill a different price for that
Okay.
because we can't bill what's called a facility
Yeah.
fee for that birth. So we're still going to make our home births very affordable by being able to kind of use some in-network benefits for our home birthers, which I've never been able to offer before. But for our birth center families, they'll be able to use their in-network benefits for everything just as soon as we get contracts. And we're telling everyone just follow us on Instagram because
Yep.
the minute that we get a contract, we're going to be blasting that all
100%.
over town.
Everybody's phone's gonna be blowing up with a whole bunch of things.
That would be the hope and the goal.
Oh,
Yes.
I love it. Oh,
Yeah.
amazing. Well, thank
Mm.
you, Jen, for chatting with me
Oh,
today,
this
and
is
I
so much
appreciate.
fun.
Yeah, absolutely.
Yeah.
So have a great day.
Thanks, Jess. And we love sending families your way. Thanks for taking care of our families and I mean, birth goes so much better whenever they're seeing a chiropractor and their babies are all lined up and their bodies are all lined up. I mean, it's a midwife's dream to have a doula and a chiropractor on your team. So
I
go
love
hire Jess.
it. Sounds good. Well, thank you.
Oh, thanks, Jess. Nice talking to you.